Acute coronary syndrome, ST elevation, MI treatment steps. So number 1 is oxygen. Oxygen should only be given if the patient has a saturation of less than 94% in keeping with British Thoracic Society oxygen therapy guidelines. Second is GTN. They can be given either sublingual or IV, but they are more useful when the patient is having ongoing chest pain or hypertension, but should be used in caution if the patient is hypotensive. So low blood pressure, then you cannot use it. And morphine. And morphine should only be given for patient with a severe pain. Third is antiplatelet therapy. So there is dual antiplatelet therapy. Aspirin 300 milligrams per oral. And second antiplatelet agent, it could be clopidogrel, prasugrel or tigirol. Fifth is anticoagulation. So for anticoagulation, you have to decide according to the procedure which anticoagulation should be given. If the patient is going for PCI, then low molecular weight heparin can be given, and it is more preferable as compared to the others. If the patient is going for thrombolysis, then low molecular weight heparin. If there is no reperfusion therapy, then fondaparinux is preferable than low molecular weight heparin. After that, primary PCI, primary percutaneous PCI, percutaneous coronary intervention should be offered if the presentation is within 12 hours of the onset of symptoms, and PCI should be delivered within 120 minutes. But if the patient present after 12 hours and still have an evidence of ongoing ischemia, then PCI still should be considered. In the cases where there is an STEMI and primary PCI is not available, then thrombolysis or fibrinolysis should be offered. And same, it should be offered within 12 hours of the onset of symptoms. And when the PCI cannot be delivered within 120 minutes, for example, consider that it is a small district general hospital in which there is no facility for PCI, then you can give thrombolysis and then decide for the PCI. After giving a thrombolysis, repeat an ECG within 90 minutes and see ST segment resolution, ST segment elevation resolution. If it's less than 50% resolved, then you have to do a rescue PCI as soon as possible. But if it's more than 50% resolved, then still you have to go for the PCI, but the time limit or timeline is not given. So in summary, STEMI patient, oxygen if less than 94% saturation, morphine, GTN, dual antiplatelet, aspirin and second antiplatelet agent, anticoagulation, and send for PCI. If PCI not available, thrombolysis. In thrombolysis, repeat the ECG within 90 minutes and see the resolution of ST segment elevation.